Bismillahirrahmanirrahim. Infection control measures in TB control. Mycobacterium tuberculosis, as we know, can be transmitted in any setting, and transmission has been documented in healthcare settings where there is exposure to persons with infectious TB who have unsuspected TB disease, have not received adequate treatment, or have not been isolated from others. Infectiveness is directly related to number of bacilli-laden droplets expelled into the air and usually declines rapidly with treatment. However, some remain infectious for weeks or months. In general, the infection control plan should include the following. Patients should be educated about Mycobacterium tuberculosis transmission and how to minimize the generalized generation of infectious droplet nuclei. Coughing patients should be instructed to turn their heads and cover their mouth and nose with their hands and preferably with a cloth or tissue when coughing. Sputum collection. Sputum collection always should be done outside, that's to say, open environment, and away from the other people, not in small rooms such as toilets or other enclosed areas. Outpatient settings. Patients' waiting areas should be open and well ventilated. Patients who may have infectious TB should be triaged to separate clinics or waiting areas. Inpatient management, separation and isolation policies. Establish separate wards or rooms for confirmed infectious TB patients, and the wards should be well ventilated. Regarding lab control, reducing exposure in laboratory include sputum collection should not take place in the lab area. A pass-through window should be used to deliver sputum samples. Radiology area measurements for infectious control include provide coughing patients with a surgical mask to wear, alternatively provide tissues or cloth, provide expedited priority service to potentially infectious TB patients to minimize the length of the time spent in the department, use the room with the best ventilation for taking images of potentially infectious TB patients, and measures of infection control for sputum induction and cough inducing procedures include the following. The cough inducing procedures, such as sputum induction or bronchoscopy, should be done only when absolutely necessary on patients who may have TB. Likewise, bronchoscopy should be used as a last resort after other less risky diagnostic measures have been taken. The intensive care areas avoid intubation on potentially infectious TB patients, improve ventilation in intensive care areas. Environmental controls reduce the concentration of infectious droplet nuclei by maximizing natural ventilation. More complex and costly methods involve the use of mechanical ventilation, such as window, fans, exhaust ventilation systems, in isolation rooms or wards to produce negative pressure and prevent contaminated air from escaping into hallways and other surrounding areas. Additional complex and costly methods include air filtration to remove infectious particles and ultraviolet germicidal irradiation to kill Mycobacterium tuberculosis organisms. HEPA filtration in small rooms with a limited number of patients or in other small enclosed areas. HEPA filters HEPA filters units may be a useful alternative to mechanical ventilation or requiring structural changes or to UVGI. HEPA filtration units may be freestanding or may be permanently attached to floors or ceilings to minimize tampering. Personal respiratory protection, protection of HCW from inhaling infectious droplets through the use of personal respiratory protective devices which are designed to fit over the mouth and nose and filter out infectious TB particles. The type of surgical masks, cloth, or paper commonly used by healthcare workers do not filter out infectious droplet nuclei, although they may be of some use if placed on patients to prevent generation of such nuclei. Respirators. To protect healthcare workers from Mycobacterium tuberculosis airborne droplet nuclei, a respiratory protective device with the capacity to filter a 1 micron particle is needed. Respirators are a special type of mask that provide such a level of filtration and are closely fitted to the face to prevent leakage around the edges. If the respirator is not fitted correctly, infectious droplet nuclei can easily enter the person's airway, potentially resulting in infection. TB infection control in the home. Patients can be sent home while still infectious if a follow-up plan has been made. Patient is on standard treatment and direct observed therapy arranged. No very young, under 4 years, or immunocompromised persons in households. Patients willing to refrain from travel outside the home except for healthcare visits. Healthcare workers visiting patients at home should instruct patients to cover mouth, nose when coughing or sneezing, wear a respirator when visiting or transporting an infectious patient, collect specimens in well ventilated areas. Healthcare workers whose responsibilities include visiting patients at home should participate in an annual TB testing program.